Today's webinar is called Bringing Patient Engagement in Health Research and Knowledge Translation Together, and it will be hosted by Mary Brachaniec and Lesley Singer. And Mary and Lesley are both patient partners within the Chronic Pain Network. And I'm just going to briefly introduce them before I hand over the reins of the webinar to both of them. As I mentioned earlier, we are recording the webinar, so we'll put it on our YouTube channel after the session today. You can also see Mary and Lesley's and the Chronic Pain Network's Twitter handles, so feel free to share things on Twitter and social media otherwise. There's going to be a couple of touch points here where Lesley and Mary ask you to share some of your thoughts online too. So I'm going to introduce Mary and Lesley now. Mary Brachaniec, as I mentioned, they're both patient partners, so individuals who live with chronic pain who are part of the Chronic Pain Network. Mary has been a physiotherapist and a volunteer and patient advocate with the Arthritis Society, the Cochrane Consumer Network, and the CIHR Institute for Musculoskeletal Health and Arthritis Knowledge Exchange Task Force. And Mary currently serves as a CPN patient partner and a Knowledge Translation Committee member. She also provides a caregiver perspective for the Pain in Older Adults research team that is led by Dr. Thomas, I'm terrible with his last name, I'm going to try it, Hagestravopoulos, and he's located in Saskatchewan. And here the focus is on mobilizing knowledge to improve pain assessment for people with dementia. Lesley Norris Singer is currently a practicing physiotherapist and an educator course coordinator at the McGill University School of Physical and Occupational Therapy in the Certificate of Chronic Pain Management. And Lesley has had neuropathic chronic pain since 2002 and is a member and current co-chair of the Knowledge Translation Committee at the CPN, as well as a member of the Training and Mentoring Committee of the CPN. So without further ado, I'm going to hand things over to Mary and Lesley. I'll come back on a bit later in the webinar when we take questions. So as I mentioned, feel free to type questions and comments into the chat and we'll come back to them at the end. So I'll hand it over to you, Lesley and Mary.
Do I have my slides up?
The slides are up, Lesley. You just need to ask for an advance. So Kim, maybe you can advance? Super, thanks.
Okay, how do I get them? Okay, why don't I see the slides big? There, okay, good. So Dawn, thank you for that introduction and thank you for the invitation to Mary and I to do this webinar today. Welcome everyone, and I'm going to start here with the outline for today's webinar. So Mary and I are going to speak about patient engagement and the SPORE. We're going to be speaking of patient engagement and knowledge translation separately. We'll speak about IKT or integrated KT versus end of grant KT, which end of grant more people are familiar with. We're going to speak about our journey in patient engagement as well as in knowledge translation. And then after that, some KT tips for you and your team going forward after today's webinar. Next slide, please. So let's start with the ABCs of patient engagement. What is patient engagement? It's active collaboration. It's engaging patients in all aspects of, in this case, chronic pain. So in the governance, in the priority setting, in conducting research, as well as in knowledge translation. And who are the patients that are involved? They can be individuals with the lived experience of having chronic pain, but they can also be family members or close friends, relatives who happen to be involved with the patient's life with chronic pain. And so they can be observers or people who are involved with the person living with chronic pain. Patient-oriented research is a continuum of research done with patient partners, and it focuses on the priorities which are identified by patients, outcomes which will be valuable for patients and as well as researchers, and it's conducted by a team, and that team includes all the stakeholders as well as the patient who is involved with them as a multidisciplinary team. And the patient-oriented research applies knowledge generated to improve health systems and practices for people living with chronic pain. The patients in this case are bringing their expertise, and they're the ones who have that expertise of living with the chronic pain. Next slide, please. What do we hope to achieve by engaging patients? We hope to have respectful collaboration in the team that includes the patients, the researchers, healthcare providers, so everyone is on sort of an equal footing. Everyone is respectful of each other. That experiential knowledge that the patient provides is valued as evidence and part of the research process. The research is informed and co-directed by patients, so they're an equal footing. And the common goal is timely implementation of quality research into practice to give better outcomes for people living with chronic pain. Next slide, please. In SPORE, we have a framework for patient engagement, and that framework for engaging patient aims to make sure that the right person gets the right treatment at the right time. So we all know that people living with chronic pain are unique. They can't be compared to another person who has the same diagnosis even. And so it's not one-stop shopping for treatment. You want to make sure that that individualized treatment gets to that right person, and it's done in a timely manner so that research can bring this down to the clinical level, down to the patient in a timely manner. So patient partners can be engaged in priority setting, in project planning, in outcomes, as I mentioned. They can even be involved with data collection after the research is done to analyze the findings, to make decisions based on those findings of where you're going to go. Is this going to filter down to the patient right away? Does this lead to another question which needs investigating? So where are we going to go with what we found? And then being involved in the knowledge translation activities that can be throughout the whole research project, not just at the end. So early stakeholder engagement, early patient engagement will lead to the best outcomes because, as you can see, it's circular. The patient is involved in the priority setting, the knowledge translation at the end, leading perhaps to another question. So the circle continues. So involve your patient partners at all points. They're not experts in everything, in every aspect, but they can provide in all different areas or in all areas. Okay, Mary.
Thanks. So we'll move to the next slide. So, okay, defining knowledge translation. There's a lot of misunderstanding out there about what knowledge translation really means. And CIHR defines this, and this is I think a definition that we've all heard before, but it doesn't hurt to go through it again. It's that dynamic and iterative process that includes synthesis, dissemination, exchange, ethically sound application of knowledge to improve the health of all Canadians by providing better health services and products and strengthening our healthcare system. The Michael Smith Foundation for Health Research, based out of British Columbia. This one's a little bit more straightforward, and they define knowledge translation as that broad range of activities to improve the use and application of research evidence for practice, policy, or further research. We hear about the gap, I think the valley of death is another term for that gap between research and implementation. So much is lost there. All the opportunities for the best treatment, for the best evidence is lost. And that's what we're really aiming to diminish, is that gap in knowledge application and implementation. So it's really about sharing research findings in accessible and understandable ways with all of our target audiences, whether they be patients or the public, whether it be clinicians, other researchers, policy people. Those are the audiences we generally talk about in knowledge translation. So we'll move to the next slide. So what are these terms, end of grant knowledge translation and integrated knowledge translation? End of grant knowledge translation is what we have historically thought about when we think about sharing our research findings. Sometimes we don't really think about it until sort of towards the end of the project, and it tends to be what we might submit or publish in a journal, what we might present at a conference, that kind of thing. But really, knowledge translation is so much broader than that. And CIHR talks about integrated KT. And that's when we move well beyond end of grant knowledge translation to a lot of the things that Lesley has already talked about, to all of the steps of the research process, including early on. Bring your stakeholders in early, engage them early, including your patients. What are the research questions that are most relevant to them? What is most urgent in terms of what needs, what they see as the gaps and what they need and what the clinicians on the ground are asking for. And again, your stakeholders can be involved in methodology, outcomes that are important to them. In recruitment, I had the opportunity to work with Dr. Stavropoulos from Saskatchewan, and I was able to bring in some of our networks for recruiting for a study, and it really did help in terms of the numbers that we were able to achieve. Data collection, dissemination, and of course it's evaluating. Well, did we communicate our research findings, and what was the impact of that? So I've got sound familiar there at the bottom, and we'll just move to the next slide. There's a lot of overlap between patient engagement and integrated knowledge translation. They both involve meaningful, active collaboration between the stakeholders. They both involved early, bringing people in early, and really the goals are very similar. So that brings us to our next slide, which is our first question for you, our audience, participants today. With the conversation that we've had so far, what do you see, what are the similarities and differences between integrated KT on the right and patient engagement there on the left? And let's get the chat box going. Let's put in some of your thoughts there, or use the CPN Chronic Pain Network handle and tweet some of your thoughts out and really get the conversation going. So I'm going to hand over back to Lesley. probably go to the next slide, but I'll give you a minute or two to gather your thoughts on that.
Also as well, now that you've heard some of the theory, let's look at putting that in practice and looking at our experiences in both patient engagement and knowledge translation. I'll have the next slide, please. So here we have the governance structure of the chronic pain network. And what you'll notice at the top is the steering committee at the helm. And we have patients involved in the steering committee. I can think of Lynn Cooper as one. And the next level, we have the executive committee, and we have patient partners there as well. I can think of Jacques Laliberté off the top of my head. And underneath that, we have the different committees that are involved with the chronic pain network. And in each of these committees, we have a patient partner who is the co-chair of the committee. So you can see that patients are involved in all levels of the governance structure. We'll go to the next slide. Here, I wanted to show examples of where the Knowledge Translation Committee was involved. And in the very beginning, we did a poster on what we were going to do and what we were about. And this was a poster which the Knowledge Translation Committee presented at an annual meeting. So we wanted to get across to the other committees what it was we were doing, what it was they were doing, so that we would know sort of what commonalities we had, how we could work together. And so this is an example of patients working in the Knowledge Transition Committee to get information across to other members of the network. On the right, this is a similar thing, except here Mary was doing an oral presentation. It was probably a year later. And so here she was talking to the executive committee, the steering committee, the members of other committees about what we had done in the Knowledge Translation Committee and how it related to patients, how we were moving along as a committee of the Chronic Pain Network. Next slide, please. So here we have some examples of publications that patient partners were involved in, and it applies to somewhat of a decision-making with the patient as well as with the researcher, especially the two, the left-hand one and the center one, were topics which were very relevant and timely and great for researchers to read, great for patient partners to read, because it involved discussions that should take place when patient partners are involved with researchers, and not necessarily that it's going to spell out how much compensation the patient partner is getting, but to start a dialogue about compensation so that everyone is sort of on the same page, things are out in the open, and it's, I thought, a great place to bring into a topic when you're starting off with a research partner. And the guidance on authorship and acknowledgement of patient partners in patient-oriented research brings to light the fact that patients can be co-authors, they can be involved with research and be acknowledged on papers. So both papers brought an awareness about for both sides. And on the right, we have an example, timely publishing of chronic pain, vulnerability, and human spirit while living under the umbrella of COVID-19, sorry. And here, Mary, as well as another patient partner, worked alongside Richard Hovey to produce this, this article. And so we have examples of where patient partners have been involved as co-authors and helping with decision-making. Next slide, please. Here we have examples of priority setting. So on the left, we have Partnering for Pain, which is an initiative that Catherine Burney and Patricia Poulin and Jennifer Stinson were involved in. And it's where there were priorities set for the pediatric population. And so in this priority setting, there were definitely a lot of patient partners, because you had patient partners who were living with chronic pain. You had more parents of younger children with pain involved, and they all got together, and they were part of this initiative, which was a big initiative to bring out education material and bring out further things to get things done in the pediatric population, things that were priority for these people. And so you had a lot of patient partner activity in that partnership. And on the right, we had the similar thing, except now it was with adults. So you had what matters in chronic pain care in Canada, but to adults. And Patricia Poulin was involved with Jen Stinson on this one. And you had patient partners again who were involved with what is important, what matters to people in the adult population. On the bottom one, you had fibromyalgia patients, what was important to them, and Mary was involved with this one. And so you can see that patient partners are involved. What's important? What needs to be looked at? What can add to the information that we already know? So looking at the priorities, important part of patients being involved. Next slide, please. So now again, we're going to look at what have been your KT experiences, especially with a patient partner? What have you found that worked well? And what have you found that you might change because you found it didn't work as well? So you can go in the chat box now, or you can go again on the Twitter handle and tweet your experiences, and we can talk about them later. Okay, next slide, please. And we'll go with Mary.
Thanks, Lesley. Okay, so we've talked a little bit about our experiences, and now we want to talk about tips for you and your teams for moving forward in knowledge translation planning. So we'll go to the next slide. And I really like this diagram that Melanie Barwick from Sick Kids Hospital posted in an article in 2018. And she talks about very early on in your research process, you should be talking about your KT goals. And they can be very varied depending on your audience, depending on your research. Is it to generate awareness and interest? For example, the chronic pain community, we really want to increase awareness of chronic pain in Canada. So that might be a goal for a team, depending on what the research is and what the findings are. Is it to share knowledge and to educate? Is it to inform the next research process? Is your research biomedical that may lead to a clinical study next time? So is it to inform the research community? Is it to inform decision making? Is it to facilitate change or practice, policy, or behavior change among patients or the public? And I guess when I think about the last point, that second last point there, public behavior change, we can think about public health in Canada right now. And there, the evidence is coming in, the research evidence is coming in as this pandemic evolves. And really, public health is trying to turn that around into appropriate public messaging. And that's knowledge translation. Is it to develop technology or a patent on a process in health or a product. So depending on what your goals are, will really influence what your knowledge translation planning is going to be. A caveat here is that you want to make sure that you place your research findings in context with a larger body of evidence. For example, an observational study, that might really inform other researchers so that, or your research team to move on to a clinical trial, for example. You might still want to let people know about it. It will give patients hope to know that there are researchers working on their clinical problem. More robust evidence may, your KT goal may be to facilitate change in terms of practice, policy, or behavior. So let's move on to the next slide. Okay, another big thing is to know your audience. In addition to making sure that the information or that the language is presented in an understandable way, you want to know in what way your audience would want to receive the information. What format would it be? Would it be oral, written, visual? Would it be a podcast, a webinar? Would it be a plain language summary? Would it be a poster, an infographic? And then once you find that out, it's important to find out in what way are we going to get the information to the audience? What communication pathway are you going to use? Would it be radio? Like for public health, for example, they're using lots of different ways. Would it be via social media? Would it be via your professional networks or publication in a journal? These are really important considerations. A quick example, Janet Gunderson, one of my fellow Chronic Pain Network patient partners, she and I were on a research team, Cochrane review team that was publishing a few studies on exercise and fibromyalgia. And we had the opportunity in 2013 at a global congress, research congress, to bring together lay audiences, lay representatives, I guess, from around the world. And we presented this very question to them. Here is our evidence. We're almost ready to publish, our team is. This was led by Angela Bush from the University of Saskatchewan. And how would you want to receive it? How do you think your communities would want to receive it? And how can we get it to them? And it was really interesting, the diversity in responses that we had. Okay, let's move on to the next slide. So there are lots of tools and templates out there to help you and your team develop your KT strategy. And we'll go on to the next slide. And I mentioned already Melanie Barwick from the Sick Kids Hospital in Toronto. She and her team they have a template, a research, and there's lots of templates out there, but this one in particular is very good, and it's used by some of our Chronic Pain Network teams, and it's very good. It will bring you and your team through the planning from the beginning to the end, to the evaluation, and accompanying this template are teaching videos. And they're wonderful, and we recommend them, and they can really help you. Okay, let's just move on. I think we're getting to Lesley's slides. Go ahead, Lesley.
Thanks, Mary. This is the lay summary template that we used at the Chronic Pain Network. So we gave this, or made this accessible to the researchers whose projects were being funded in the Chronic Pain Network. And we we're thinking of what were the questions that would be important to address, because you don't want it too long, you don't want it too complicated. So the first one we thought about was, why was the study done? So keep in mind that it needs to be in lay language. So a lot of times what happens is researchers are using jargon, scientific words, and they're not, even though they're common for the researcher, they might not be common for the lay population. And so you need to be aware of this and change the wording so that it could be understood by the lay population. So in this, you want to say, why are you doing this study? Why is it important for the patient partner, for the patients at large? Are you trying to answer a question? Are you trying to advance the findings from some other project? So how would the information fit into all what we already know? Or are you trying to establish new knowledge? The second question, how was your study done? So we would want to know, like, how many people were involved in your study? And were they men? Were they women? Was it mixed? How was it done? So describe the methods, but again, using lay language. And so we want to know, how was the study done? Who was included in the study? Was the study, was the research done so that you had to find out something weekly, monthly? Was it done every 2 weeks? And that the details there. After that, what were your study results? So explain what the study found out. What did it contribute? And why is it important to me as a patient? If you do have a publication, you can put a link to it so that the population reading it can refer to the scientific article or what was being done. The fourth one, we thought, what was a patient partner involved with your study? This is important, or was important to us, because in the CPN, there was supposed to be a patient partner involved in all the studies. And so if this was done early in the project and you didn't have a patient partner, this enabled us to get a patient partner involved with your study, even though it was not from the beginning. And it also gives credibility to your project when a patient is involved. It gives an awareness that patient partners are involved with studies. So there were several reasons. What I want to say about this lay summary template is we think about it as what was done after the whole study took place, after your research took place. But remember that you can do this at the beginning of your research project and talk about it in the future. Why are you doing this study? What do you hope to find? Or what do you hope to contribute? And that way, if you get it out to the lay population, don't underestimate the social media that will be accessible in this regard. And sometimes a patient partner is involved with a group that might be interested in that type of research. It might get you more funding to further your study. And so don't wait till the end of your study. The lay population want to know what is going on. What do you hope to find? What is going to be studied, rather than all the time knowing what was studied. So keep this in mind, as it's really important that this can be done at any time during the research project. Okay, we'll move to the next slide. This I really like, because we talked about knowing your audience. And in this Aboriginal Children's Hurt and Healing Initiative, the population was the Aboriginal children. And so this is a lay summary, but in the form of a poster, in the form of a storytelling, because the population that we're referring to like to get information in the form of something visual, in the form of storytelling. And so it has the same questions that we asked. Why was it done? So did you know? And what did we do? So the second one, the methods. And so what was done in the study is the body of this poster. And then what were the results? Well, the results were that there was this first approach to take into consideration. And what came out of it was the Kids Hurt app. And there was another app in the children's population. However, in the Aboriginal children, they're not familiar in their language with the word pain, strangely enough to the rest of us, but they call it hurt. And so if you talk to them about pain, they're not really going to know. They're not really going to appreciate what you're talking about. And so the Kids Hurt app is particular to this population. And this, to me, speaks volumes about knowing who you're talking to and addressing them in the way that they want to be addressed, as Mary was talking about. And this is a perfect example of that. And I would have to say for myself, Mary and I looked at all the lay summaries that were submitted by the research projects. And this really struck me. Know your population, yes, but this was really doing it. And it really was an eye-opener for me, a great eye-opener. We'll move on, please. Okay, Mary?
Right. So it's really, we're getting close to the end. So one of our final points is use your networks and social media. Most people on your team, they have networks. And it's really, really important to capitalize on them. For example, Chronic Pain Network today, it's a prime example of using social media and communicating research evidence. And a couple of examples that have used Twitter and YouTube fairly extensively was first the hashtag It Doesn't Have to Hurt campaign that Dr. Christine Chambers and her team at the IWK carried out a few years ago now. And really, she knew that there was evidence in managing pain in children. And when she took her own children to receive care, she saw that it wasn't being used at her own hospital. So she thought, my goodness, there's quite a gap here. So with a YouTube video, with a social media campaign, especially on Twitter, that was picked up by some heavy hitters in the parenting communities, Yummy Mummy Club and others, lots and lots of groups picked up on it, and then they shared it with their networks, who shared it with their networks, and they had quite an impact. They did publish, and I'm sorry that I don't have all the authors really visible there on the slide, but the article is there if you want to, if you can check it out. And this momentum within the pediatric pain community continues. So that was really well done. And then the team that I'm on, led by Thomas and at the University of Regina in dementia and pain, we've picked up on that. So Christine is helping us with it. She's on the team. And she, and we're basically, our hashtag is See Pain More Clearly. And we have seen a huge gap between the available evidence in assessing pain in dementia, especially, well, really in people who no longer have the ability to tell others that they're in pain, especially in long-term care. And the evidence is there, but it is not being implemented. And it's a big gap. So we're following the same framework that Christine established. And I have this written down, so I have to look at my notes. But we developed an online repository of the available evidence, some of which was done by Thomas to begin with and his team in Regina. And we developed a YouTube video. We had a 5-month campaign last year the See Pain More Clearly campaign. We had, in 5 months, we had 5 million Twitter impressions. It was used, the hashtag was used in 31 countries, and the video was viewed 51,000 times. So that was really good. And we now have some more funding to expand this knowledge translation campaign. And we will then be moving to some of the other social media platforms and sharing evidence in different ways. So we have networks. It's really, we can use them to help share our research findings. And a lot of research teams, universities, research networks, et cetera, have communications people and support that you can tap into as well for help there. So let's move on to the next slide. So I guess what we want to do now is just get some conversation going. What have you done that you and your team's done that's worked? What would you do next time to make it better, to improve the implementation and impact of your research findings? And any questions or comments are very, very welcome. So I'll maybe turn this to Dawn.
Yeah, thanks a lot, Mary and Lesley. I just wanted to let you know about some of the comments that came into the chat as well, and those kind of two pause points. So a couple of things here. I think your first pause point, you'd asked about the overlap between knowledge translation and patient engagement. And Sunny, I'd invite you to come off mute if you'd like to add to this. You made a comment that in some cases, audiences may be different for knowledge translation and patient engagement. So that was one comment that Sunny made. Sunny, did you want to add to that at all? And no pressure if you don't want to.
No, that's fine. I'm here.
Okay.
So the question had to do with so the patients being engaged through all the planning phases. If you're doing experience-based co-design and that kind of stuff, isn't necessarily always the target audience. So that Venn diagram actually is kind of linearly or temporally appropriate. The knowledge outputs may reflect back on those patients and similar types of patients, but they may also reach out to another audience that wasn't necessarily involved with the initial project planning and what have you. If I have the opportunity to ask another question, though, is two things actually. Is when you're creating your KT products and what have you, is there involvement or awareness of adult learning theories, and what are the attributes of key features that adult learners like to receive and or what they can digest well? And I imagine that's pretty diverse. The second thing is, and this is at the beginning of any project, and perhaps you've already addressed this with your patient engagement networks, is what training does your patient participants undergo to participate in different types of study designs? Because, you know, if they're involved with clinical practice guidelines or various other types of things, like there are specific steps and roles in doing those studies that I assume the patients perhaps gets training in, or are they just literally there to represent the patient lived experiences and that's it? So one comment, two questions.
Thanks, Sunny. Mary or Lesley, would you like to respond to Sunny?
I think for your comment, thank you for that comment. As for your second one, which was the question about adult learners, I personally am not aware of any information about that, so I can't speak to that. In the training, all patient partners get training how to be involved sort of as your patient partner. However, all patient partners kind of have a life apart from their being a patient. And so they have different lives, so different experiences. So for instance, I learned a little bit about research as I did my master's, or as a physiotherapist. And so I think that I can participate as a patient and include my background there and be involved in a way that another patient partner might not be able to. And also, when you're starting with the researcher and you're forming this partnership, you sort of talk about things and your experiences, and you're not involved with every aspect of the research project. And so you bring your expertise into it, and you might not be able to be involved in a certain aspect of the research. But I think you want the researcher to be able to explain to you in lay terminology so that you can understand what's happening. And I'm thinking of a project I'm involved with now, which is a big project on education, and we have experts in different fields. And sometimes I get lost in their discussions about it, and I have to ask later for a clarification. And so I think that I can appreciate your point. And I think what we have to think about is that we're not all experts in everything. I hope that sort of speaks to your second question.
Yeah, that's helpful.
Mary?
Right. Great questions. I think, I mean, your first question about adult learning, I think my understanding and reading some of the KT literature through the years, there's so much theory out there in knowledge translation and adult learning, behavior change, that kind of thing. And I mean, we're not experts at all here in this field. And I think we do rely on experts and some of the teaching tools and templates and knowledge translation tools available to us. So I'm sorry that doesn't really answer the question, but at least it touches on it. And in terms of training, I think Lesley explained it quite well. The Chronic Pain Network, for example, Cochrane, when I was involved, there is training. It's general training, and I think each research team is different, and the methodologies are different, the teams are different. And I think it's really important for the PIs to talk to their patient partners about the project itself, and then to have that two-way dialogue, because we will go into projects that are well over our heads. And it's really time to have that conversation and perhaps to offer more specific training related to the actual project. And if it's a common theme within a network, for example, then that could be a training session for the patient partners. Dawn, does that answer that second question?
I think so. Sunny, you can let us know. Otherwise, I just wanted to add to the training comment is that Diana has commented that CIHR Strategy for Patient-Oriented Research does have a national curriculum that's available, Sunny. I'm happy if you want to type in your email address, I can provide you with more information about that. But exactly to Mary and Lesley's point, I'd argue there's not really an approach to standardized training for patient partners. But I really liked what Mary said too about I think it's important for teams to realize when they bring on patient partners to ask patient partners what kinds of needs they might have with respect to training. And I think we also encourage researchers to not be afraid to explore training opportunities for working with patient partners and talking to their patient partners about that too.
Thanks very much. I'll give you my email. I'm actually posting also a link here on the chat. The University of Florida has a citizen scientist training program that they've been running for years, where they train and credential citizen stakeholders in various research and quality improvement programs for their hospital systems. And it's very intriguing to watch. We're going to be probably adapting this in Niagara region in some way or shape to create a brand new health engagement network with our community partners. So, but I'll take that CIHR link as well. That'd be great.
Thank you.
Sure.
Thanks
Thanks for posting that, Sunny. Awesome.
Yep.
I'm just scrolling through the comments, ladies, just so that you know. Diana had also made a point about back to that really first discussion around patient engagement and knowledge translation, and she feels that patient-oriented research is really foundational to any kind of successful knowledge translation. Diana, I don't know if you wanted to make additional comments about that in the chat, or you're welcome to also come off mute if you'd like to chat. Okay, that's all right. Nader had made, oh, go ahead, Diana.
I've lost all my little icons. I don't know where they went.
Oh, we're all having fun with Zoom today, so it's not just you.
They're all gone. The only thing I know is you're recording it. Anyway, I was really, that was a very sort of blanket, blunt statement, but I want to just, I had another question, so I'd rather ask that. And on the slide that you had, from the women's from sick kids. Anyway, there was a comment that KT is different than implementation research. And I'd really, that's the place where I think there is a big hole. There's a lot of moving forward that KT is beyond presenting at conferences and writing a scholarly article. But the big hole in my mind is that, how do we really, implement these findings in everywhere, clinical practice, health education, that kind of thing. So, and I see you nodding your head, so please talk about it.
Oh my goodness, it's such a good question. I still really struggle. I mean, I started, I went back to school a few years ago and did a knowledge translation course, and it was a master's program, and I'm still struggling with some of the terminology. And this article that I cited, the Is a Rose by Any Other Name by Melanie Barwick, it really simplifies things in my mind. And I mean, as she talks about implementation science and the differences in terminology between knowledge translation and implementation science. And to be honest with you, I'm not completely 100% clear on all of it. She does talk about knowledge translation as sort of being an umbrella term under which some of the other terms fall. And I guess I would refer you to that article, and there may be people on this call that have far greater experience and understanding of some of the nuances between some of the terminology used in this field. But I think, this is a practical kind of application of knowledge translation that we're talking about today, rather than some of these nuanced conversations. But it's a very, very good question, and there is some confusion out there with some of the terminology, I think. And I guess I would invite anyone that can expand on that to jump into the conversation.
I think from my perspective, looking at not just the terminology, but the practicality of it, I think of the see pain more clearly. And Mary, you got me very interested in that. And as I'm an educator in chronic pain management, I've taken this video from there and implemented it into education in assessing people who have pain and dementia. And I can't tell you the feedback that I've gotten from clinicians, because our certificate is for all healthcare clinicians, and the awareness, the impact that video had on them of how people can be in pain and how they need to look at it differently. And I think of, that came from a research project that came onto social media that I picked up, and I'm an educator, and I've put it into my program. And now these clinicians are using this when they assess people with dementia and pain. And I mean, I get lost in the lingo of things, in the terminology of things, but in practicality, I just love the way that worked for us. And that I feel clinicians are better equipped that have taken this course, and they in turn will give in services in their clinics, and more people will pick it up. And I know that's not being measured as how well this is being picked up, but it is happening, and in a way that probably a lot of people haven't even thought of. And that amazes me. That's my 2 cents.
And I guess in terms of the implementation science, or the looking at what works and what doesn't in knowledge translation, our CPAIN more clearly team, the additional funding that we've received is allowing us to measure that impact, and it's being run mostly in Saskatchewan. We'll have a broader campaign on social media, but then the implementation science, how did it change practice in Saskatchewan? That will be a part of the project, and then hopefully published so that other teams can learn from it and go from there. Yeah. So I guess, Dawn, I guess we're moving to the end, and I'm sorry, I'm not sure if we fully addressed that question or not. But let's keep the conversation going. It's a great conversation, and Lesley and I have really tried to take some of the fluff, I guess, and to put it in right down to application and on the ground running with this. So thanks so much, everybody, for coming today and for the conversation. And I'd like to let you know too that the next webinar, entitled Patient Engagement in Basic Science Projects, a Case Study, will be held on October 22nd, 2 p.m. Eastern, by Nader Gezimlu, who's a participant on the call today, who's co-chair with Lesley of our Knowledge Translation Committee, and Lesley as well will be co-presenting. So we invite you to join us then. And thank you again for joining us.
Thanks a lot, Lesley and Mary, and thanks to everyone who's joined. And we hope you have a great afternoon, and hopefully you can continue to join us in our series. Take care.